Okay, welcome back. Video 2 for the patellar tendonitis, jumper's knee, runner's knee, knee pain, whatever you want to call it. We got a full house. We got Gucci monitoring the film, quality control. We got our boys at the door waiting to say hello and goodbye. So hopefully it doesn't get too loud here. And then of course Rio, our 2016 Olympian, behind the camera. So, getting started. Basically we want to focus on ungluing the tissue, getting it moving, sliding and gliding again like the way we want it to, and then the stretches we need to do to really allow that tissue to open back up. So first, I like to always start with the mobility because it makes the stretches more effective, deeper, and for the most part less painful. If the stretch ever feels more painful, it's most likely because your range of motion is greater. You're going farther into the stretch. So I've got a bunch of different tools here. I got the old school white roll, which I still really enjoy. It's a bit soft, but sometimes that's a nice way to start, just to start ungluing this tissue. So I'm going to go at a different angle here, so hopefully Eva, you can see me here. So basically, I think the weight might get in the way a little bit. We can always focus on the whole leg, or what I like to do a lot of times in this knee pain area is just focus the small movements right here. Even if you want me to turn or change my direction, just let me know. But you can also see that I'm kind of turning my leg or turning my foot, however you want to imagine me saying it. So I can start getting different areas in here. I can even kind of pause and just go left to right and look for some of this tissue that's a bit tight. And then as I feel it start loosening up, I can then move to a little bit of a different roll. We've also got an important area. I didn't really discuss too much about the above the knee. We call this kind of the supra. So above patella, that's the bone, pouch. And a lot of times this is also what gets really glued up and doesn't like to move. So there's a test, the stretch we do for it, I show you later, but this is the reason we focus also right on this little pouch area, because this is where all the havoc is wreaked. So now here, what I like to do sometimes is I like to just kind of lay myself down and then turn my knee, and I can literally just chill in this position. Not have to really work my core too much at all. I don't want to make sure I'm not breaking my back as I do it. That's why I've got the smaller roll. And I just kind of turn in this position, and then anytime I want, I can just come back up on my elbows and continue to work in this area. And like I say, I usually, I don't know, probably hit the roll for about 5 to 10 minutes, just really so it starts to open up. The goal is not to cause so much pain that you're crying, but it's to really start kind of getting a deep massage in that tissue. Because remember, we believe that fixing the body is like a language. You speak 1 hour of the language you're learning a week, you'll get better but slowly. If you do 10 minutes a day of the language you're trying to learn, you're going to learn much quicker. And we believe that the body works the same way. So I also brought just a simple stick. If this is also an option for you guys, I'm a bit bigger fan of the roll, but this is also another option. This is a little bit easier. If you do have a stick around, it's something that you can do, maybe while you're in more of a public place. Just like that. Again, not my favorite option, but I have it, so I wanted to show it. And then the last thing before I get into the stretches is the Voodoo Bed. I think anybody that has a Voodoo Bed knows how to use them, so I'm not going to go through it. But basically, we would wrap, I would say starting above the knee, we can go across the knee for the second time, keeping the patella open. And we can even do one below, just wrapping very tight and going through some of the motions on how to just open the knee up. If you have some questions on how to do it, I can make a separate video on this, or you can also Google the Voodoo Band or floss band with the knee. Okay, so once we've kind of opened that tissue up here, what I like to do is in this stretch right here, I usually get the mat against the wall, but actually if you do this correctly and you have the mobility, you don't even need the mat, because as the knee goes directly against the wall, 100% against the wall, your patella is actually not on the ground. So you don't even need a mat. This is one of the ways I test the athletes to make sure they're doing it correctly. And what I notice is when people get in this position, if they have pain in this position, not from the stretch, but it hurts from the contact point on their knee, this is usually a nice indication that there's some patellar, there's a suprapatellar pouch issue going on, and that's again when we turn to the roll. The next thing I want to do is then get my right foot in this position, or in this case, in a good position. I don't want to break one leg as I'm stretching the other. And then from here, I just want to see if the athlete is able to come up. I'm a bit tight myself, so you can always use a roll to help a bit. And notice my foot, if you can see that, is not out to the side. we want to load that joint up and make sure that foot stays behind the butt. If the athlete or yourself is not able to get in this position, it's okay to pull the knee out a little bit to help release some of the tension. But remember, if you're having some of those issues and you're having patellar pain and you're not able, or knee pain, and you're not able to get into a comfortable position like this, that means you're missing range of motion, and for sure that's one of the reasons why that you have your knee problem, yeah? So the next one I do, and then if we have any questions we can just write further, is going to be I get in that hip opener position. Again, I'm working on my left leg. So I take my right hand, just like the stretch I did in that Magic Mike hip mobility, I grab it from here. And now the nice thing about this is I can drive my hip forward by allowing my pelvis or my hip bones to stay straight, or I can begin to turn and really get that rectus femoris that causes a lot of problems. So as I turn here, I start really working on that one hip muscle or one quad muscle that connects below the knee, so it crosses one joint, and then connects to the ASIS, so it crosses another joint. So we've got that one muscle in our four quadriceps that's crossing two joints that sometimes gets tight and causes some problems. This can do the knee, and this can also cause the back. So that is why on this stretch, it's a little bit of a side tangent, so I hope you guys follow along, why I like to turn into it like this. And I think right away with a little bit of that mobility, a little bit of stretching, if you're able to use the floss band and have one, that's also fantastic. And the stretches, you now understand the injury, and you should see the injury definitely go away. So stay active, like my amazing pug here, who's full of energy. And until next week, make sure to sign up for the newsletter if you haven't already, which I think you're watching this through the newsletter, so probably. Like the Facebook page, Grant Training Systems. YouTube page, also Grant Training Systems. And if you guys need an appointment or anything from me, don't hesitate to contact. And if you have questions, also write me, yeah? Okay, so till next week, guys. Peace.